Root canal obturation is the procedure in which the cleaned and shaped root canal space is filled three-dimensionally with an inert biocompatible obturation material. There are so many techniques introduced which are very efficient, but if you want to do a high-quality root canal obturation, which is considered to be the best, then it is the vertical compaction technique. Vertical compaction technique can provide the three-dimensional obturation, which is at present considered to be the highest quality obturation which can be done with any of the existing systems available. Lateral compaction technique or collateral compaction technique is an essentially easy to perform technique, but it does not fill the lateral canals and the aberrant root canal anatomies. But vertical compaction technique can fill the root canal space three-dimensionally and can fill the lateral canals, accessory canals, and difficult to obturate root canal systems. In this presentation, I am going to explain the procedure for doing vertical compaction technique with graphical images which are easy to understand and perform even for a beginner. I am Dr. Benin. If you are a dentist or a dental student watching this video, kindly subscribe to my YouTube channel Smart Dentistry. I will make presentations that will be useful for dental students and dental practitioners. Vertical compaction technique can be divided into 5 stages or 5 phases. They are selection of master cone, selection of pluggers, sealer and master cone placement, down packing, and finally backfilling. Let's see all these steps one by one. The first step is the selection of master cone. Gutta-percha cone corresponding to the master apical file should be selected. The master cone should have a tuck back at the working length. For those who are not familiar with tuck back, it is the slight resistance offered by the master cone at the working length. This indirectly gives us indication that there is a close adaptation of the master cone to the root canal at the apical foramen level. This is very essential for successful root canal treatment. A radiograph must be taken to verify the extent of the master cone. Once it is verified in the radiograph, 0.5 to 1 mm of the apical end of the master cone should be trimmed and if needed must be verified in radiograph again. This shortening of the master cone is essential to prevent extrusion of the gutta-percha beyond apex while doing vertical compaction. This reduced length will be compensated and filled by the flow of softened gutta-percha during obturation. The second step is the selection of pluggers for packing gutta-percha. Spreaders are essential for lateral compaction while pluggers are essential for vertical compaction technique. There are different sizes of pluggers available. It is preferable to use hand pluggers while doing vertical compaction technique. The bigger pluggers are usually made of stainless steel which are rigid, and the smaller ones are normally made of nickel titanium which is flexible. At least 3 pluggers of various tip sizes are needed for obturation of a root canal system. These pluggers are selected and verified so that the smallest of the plugger will reach up to the apical third of the root canal. The next one will reach the middle third and the bigger one will reach the coronal third. They should be passively adapting to the walls at these levels and should never bind to the root canal walls. If any of the plugger binds to the root canal walls at this level, then a smaller plugger must be selected. Inadvertent or improper selection of a bigger size plugger and application of excessive force while compaction will lead to vertical root fracture, so it must be avoided. The next step after selection of plugger is the placement of sealer and master cone. For doing a vertical compaction technique, only a thin layer of sealer is needed. It can be applied to the canal walls with the master cone itself. After coating the master cone with the root canal sealer in a dried root canal, the master cone is placed passively and it has to be verified to have a tugback. The next step after placement of the master cone is called down packing. In order to understand down packing, let me introduce to the equipment used for proceeding the next two steps. This is the obturation unit which is needed for vertical compaction technique. Although according to the Schilder, who introduced the vertical compaction technique, obturation could be performed with a plugger and a heated carrier which was manually heated. The system which was mentioned by Schilder was very time consuming and required a steep learning curve. With the introduction of these latest equipments, it is relatively easy to do vertical compaction technique. The picture which is shown here is a calamus thermoplasticized obturation unit from Dentsply. Similarly, System B, Elements, B-Fill, and there are so many other systems which are available in the market which are equally good and efficient for doing obturation. Basically, all these units have two handpieces. One for delivering heat called as the heat carrier, which is used for down packing, and the other handpiece is for delivering softened gutta used for backfilling. The heat carrier handpiece has a tip which will get heated up and activation of a button in the handpiece. Once upon activation of the button, the tip of the instrument gets heated up. After placing the master cone, the heat carrier is taken, activated, and the coronal gutta is seared off. The button has to be activated for around 5 seconds to activate the heat carrier. Once the coronal gutta is seared off, the pre-selected coronal plugger is used to pack the softened gutta. This will make the softened gutta to flow inside the lateral canals and into the small canal aberrations, connections, etc. which is present. Once that is completed, now the heat carrier is taken to the middle of the root canal and the same procedure is repeated. This time, the pre-selected middle third plugger is used. Once the middle third packing is completed, the heat carrier is taken to the apical end short of 5 mm from the apex. After searing the gutta, the apical third plugger is used to pack the softened material. Care should be taken to pack the apical end so that the shortened gutta at the apex is filled. At the same time, gutta is not pushed beyond the apex. Once this is completed, the down packing procedure is finished. Now, the lateral canals, accessory canals, isthmus, and only the apical end of the root canal system is filled. The coronal and middle third of the canals have to be filled yet. This is completed during the last step called as backfilling. Now we have to look about the other handpiece. It has preloaded gutta inside the handpiece. Once the handpiece is activated, it delivers heat softened gutta through the tip. Now the tip is placed just short of the apically compacted gutta and gutta is injected in increments. Before the thermoplasticized gutta becomes hard, it has to be compacted with the pluggers to adapt the material to the walls. The same is repeated till the complete canal is fully obturated. It usually takes 2 to 3 increments to backfill the canals completely. Once it is completed, coronal seal can be placed. Now the obturation of the root canal by vertical compaction technique is complete. We can see the main canals along with the lateral and accessory canals are filled completely. Vertical compaction system can fill the canals three-dimensionally and if done properly can improve the success of the root canal treatment. Kindly watch more presentations from the playlist along with this video. Thank you for watching and have a wonderful day.